Okay, so this bit of the consultation is to do with the procedure itself. I'm going to take you through each steps of the procedure, but before we need to make sure that everything for the procedure is nice and safe. So we've got our factors that affect the patient, the practitioner and the environment, PPE. This is what we're going to do for the patient. So we've got a nice comfortable chair for them to sit on. In case they feel dizzy or lightheaded, we've got a couch just in case. For infection control purposes, we've got the sink with sanitizers, clinical waste disposal. Comes to myself, the practitioner. I'm bare below the elbows, as you can see, wearing my protective apron and scrubs in case there's any blood spillages, and I've got my protective mask at hand in case I need it as well. Okay, let me take you through some of the equipment that I'm going to be using. I've set up my trolley quite conveniently with everything on it that I need for the procedure itself. I've cleaned this all beforehand and laid out a sterile sheet for myself to use so that to minimize the risk of infection. First of all, to clean the patient, I've got my chlorhexidine spray, which I'm going to use to disinfect the skin. Once I've done that, I've got my gauze here to wipe the skin clean in a single circular motion. And then I've got my clean cups, which I've sterilized beforehand with the chlorhexidine, and I've got a variety of sizes in case I need to change any of them during the procedure. I've got my single-use pump, which I'm going to use to apply the suction. And then I've got a variety of blades to make the incisions on the skin. Once I've made the incision, I've got my clinical sharps bin at hand so that I don't have any nasty injuries from sharps, and I can dispose of the sharps as soon as I've used it. Once I've cleaned the area after application, I've got my bandages at hand, so I've got some Meepo dressings and some gauze with some tape in case it's a big cup. And then I've got my antiseptic cream as well to disinfect the area, just some chlorhexidine with local anesthetic on board. For my clinical waste, I've got my clinical waste bag here, which I will dispose of in the bin which I have next to the patient after the procedure itself. And just in case we have any accidents or any allergic reactions, we do have an emergency kit which has adrenaline in it in case we have any nasty allergic reactions that we weren't aware of when we were taking the patient's history.